Take a deep breath in, breathe out. Hi, Aliana.
Hi.
My name is Dr. Matt. I'm going to do your exam today. Go ahead and tell me what's going on.
So recently I've been playing track and basketball a lot, and I feel like my spine has been giving me terrible pain. It's been bad for maybe about like a month now, I would say.
Okay. And on a scale of 0 to 10, how would you rate your pain?
Like a 7.
7. Is that constant or it comes and goes?
It comes and goes.
Okay. Does it radiate anywhere laterally, like on the shoulders or hips?
Maybe specifically like my lower back, like left area, I would say.
Okay. And are you experiencing any headaches?
I am.
Okay. Where are they localized?
Right behind my eyebrows. So I just feel like an intense sharp pain there.
Okay. It could be related to the spine. We're going to take a look and see if there is any constriction of the blood vessels that go towards the spine, and to make sure that the main organs are vascularized, including the brain.
Okay.
Are you experiencing any tingling or any numbness in the fingers or toes?
No, I don't think so. No.
Okay. Have you noticed any twitching of your eyes, like moving involuntarily?
I would say rarely, maybe like once or twice, but not consistently.
Okay. Any spine injuries?
No.
What about shooting pain down the back, all the way in the heel of your foot?
Sometimes, not consistently again, but I would say maybe like twice a week. I definitely feel it.
Okay. Are you taking any medicine?
No.
Okay. And do you have any family history of musculature disease or spine disorders?
No.
Neurological disorders? Okay. And you are not in any accidents, like car accident, motorcycle accident?
No accidents.
Okay. And for how long have you been practicing this sport?
I would say for about 6-7 months now.
Okay. So here at the clinic, we do a little bit things more differently than at a regular chiropractic office. We take a look at the spine and we try to integrate different techniques to heal and make sure that we are restoring homeostasis and balance.
Okay.
I'm going to take a look first at your back and your gait to see how you balance yourself, okay?
Okay.
Okay, Aliana, go ahead and take a few steps towards me. So we're looking at the gait and how you balance your feet. Keep on walking. A little bit of pronation interiorly. Good balance on the cubicle side. Good. No inclination there. Just take 2 steps. That's perfect. Let's take a look at your lower back first.
Okay.
I'm just going to go ahead and lift the shirt a little bit. Okay, slowly palpating the sacral region. So we're looking at S1 and S2 in a vertical position. Just slowly pressing down here. Let me know if you feel any kind of pain.
I feel pain right about there.
Okay. Now, going to slowly move towards the left side. This is where you said you're experiencing even more pain. So, just trying to see if I feel any nodules, knots, or any imbalance in the vasculature. Okay, so let's do one test here. I'm gonna have you push with your heel in front of you, just like this. Perfect. And I'm gonna continue to press down. Sometimes that provides a little bit of space and it allows me to feel a little bit better. Okay, now I'm gonna have you lift your knee in a 90-degree angle. Okay. Come back to center. We're gonna do the same thing on the other side. So first push down in front of you. Any pain here?
No.
I'm feeling a little bit of swelling. Go ahead and lift your knee up. Good balance, I'm not worried. Okay, come back to center. Just palpating the height of the hips. A little bit of supination on the left side. Okay. Just going to lift this a little bit. Okay, go ahead and lift your arm in a 90-degree angle with your thorax. Okay, I'm not feeling anything swollen there. Keep it like that. I'm just gonna slowly palpate. Okay, now go ahead and lift your arm above your head. Any pain here?
Yes.
Okay, come back to center. I'm going to put your hair up. Okay. Slowly I'm going to palpate C1 and C2. I'm noticing a little bit of a straight angle here, and I would like it to be a little bit more curved. I would like C3 to be a little bit more mobile, and that will definitely give you more flexibility and range of motion in the neck area. I'm gonna have you try to touch your left ear with your left shoulder. Good. And same thing on the other side. Good. Okay. I'm not noticing any signs of scoliosis. Okay, with your left hand, I'm gonna have you try to touch this point right here that I'm Okay. Let me go ahead and help you. How's that? Any pain?
A little bit of pain.
Okay. Just gonna slowly press down in the middle of your palm. Let me know if the pain increases or decreases.
Increases.
Okay. Let's go ahead and try that on the right side. How's the pain now?
It feels worse.
Okay. Just going to do the same thing. Press down in the middle. Let me know if it increases or decreases.
It actually decreases.
Okay. Left scapula is a little bit more elevated. I would like to increase circulation in this area as well. Okay. Okay, I'm gonna have you do a 360-degree rotation with your left arm. And now with the right arm. Okay. I'm gonna have you put your arms in front of you like this and try to push in the center. Apply some pressure there. Okay, spine is deviating towards the right as we're doing this. And we would like it to be about 2 or 3 degrees towards the left. Go ahead and come back to center, relax. Now I'm gonna have you try to touch your chest with your chin, okay? There you go. Okay. We definitely need to do an adjustment. Starting with T1, it's a little bit deviated, and I would highly recommend that we try different techniques today. Any pain as I'm palpating down here?
A little.
Okay. Okay. Now, come back to center. The next thing that I'm going to tell you to do is to try to curve your shoulders like this. Okay. As if you were to hug someone, but lowering yourself a little bit down, okay? It's going to help me see the thoracic area. Okay, perfect. Okay, come back to center. Perfect. Any pain shutting down the legs?
On my left leg a little bit.
Left side. All right. I'm gonna have you first lay down. Let's do face up. Okay. Okay, Aliana, I'm gonna have you try to keep your shoulders relaxed as we're doing this test. Good. And what I'm gonna have you do is I'll have you lift your arm about 30 degrees from perfect. I'm gonna try to press it down, push it down, and just have it kind of resist.
Okay.
Okay. Okay. Okay, now go ahead and put it back down. I'm gonna have you lift it up one more time. Okay, good. Let's go ahead and try the same thing on this side. So hold it for me. I'm gonna try to push it down. Okay, now go ahead and put it back down. Lift it back up again. Okay, perfect. I'm going to test your reflexes a little bit. So sometimes if it helps if we are in a relaxed position. Okay. Relax. Good. Relax. Reflexes are a little bit diminished on the left side. Good. Good. Okay, go ahead and keep your eyes closed. Tell me if you feel this equally on both sides. Yes or no?
No.
Okay, tell me when you don't feel the vibration anymore.
It stopped.
Okay. Relax your arm. Tell me when the vibration stops.
It stops. It stopped. Stopped.
Relax.
Stopped. It stopped. It stopped. It stopped.
Okay. Let's go ahead and take a look at your legs now. Okay, I'm going to lift your pants a little bit so we can take a look at both girls. Okay. Right leg is a little bit shorter than left. This is definitely coming from the hip area. So it is pretty visible here on the malleolus. What we could do is to first test your reflexes. I want to make sure that there is nothing abnormally going on. And then we're gonna try to lengthen your legs a little bit, okay? Okay. Go ahead and tell me when you don't feel this vibration anymore.
It stopped. It stopped. It stopped. It stopped. And it stopped.
Okay. Go ahead and tell me if you feel this all the way. now?
Yes. Yes. Yes.
Okay. Going to check pedal pulses. 2 plus, strong and symmetric, so there's no vascular problem. Capillary refill is within 2 seconds. Very good. Okay, we're going to check your reflexes. Go ahead and relax, starting from the knee. Good. Good. Do the same thing on the other side. Okay. Okay, we're going to work on your toes first. Just relax. Very good. 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 Okay. Okay, perfect. I'm going to apply an anti-inflammatory oil. So we're going to focus on the posterior part of the heel. That corresponds to the thoracic area, so the more pressure we put here, the more pressure goes on T1 and T2. Okay, slowly I'm going to apply some pressure. So you're gonna feel my knuckles right in the center. We're gonna work on both legs in the same time. Okay. Okay, I'm feeling a lot of tissue right around the heels. Okay, we're gonna go ahead and try to lengthen your legs. So we're gonna apply a little bit of pressure. That's going to create space at the hip bone. Take a deep breath in, breathe out. Good. And again, take a deep breath in and breathe out. Good. You're just gonna feel my fingers right behind your neck, slowly pressing down. There's some tension and inflammation around the cervical spine. We should be working on decreasing the fluid. We could also do some lymphatic drainage around the neck that usually helps to decrease the swelling. And there's some tension that goes up on the lateral side of the cranium, which could definitely say a lot about why you're experiencing the headache. I do feel it more on the left side. Okay, is it okay if I lower the shirt a little bit? Alright. I'm going to apply some anti-inflammatory oil. And we're going to do cupping. Cupping therapy allows for the toxins to be removed through the surface of the skin. They're being pulled out from the muscles, and it helps to decrease inflammation. And we'll do the same thing on the other side. going to apply a little bit of releasing therapy here. I'm gonna have you flip on your tummy and I'll take a look at your back now. Okay, you're gonna feel my fingers right on your neck, just applying gentle pressure. And now I'm gonna find the corresponding place around the sacral and lumbar region. I'm looking for any imbalance. Okay, I'm gonna have you lift your right leg. Perfect. Okay. Put it back down. And we'll do the same thing on the other side, the left leg, and back down. Okay, we're going to do the first adjustment. This is going to feel a little bit like skin pulling. We're just going to try to crack the lumbar region. I'm gonna have you take a deep breath in and exhale. Good. And now go ahead and lift your legs up just from the knees. Hold them like this. I'm gonna have you take a deep breath in and hold it in for 3 seconds, okay? Breathe in, hold it in. Good. Breathe out, and you can relax your legs. Okay. So we're going to work on releasing the tension that has been building up around the spine. Going to use gentle cupping. This will help with the active release technique that we're going to use. Feel a little bit of pressure as we're activating the spine. This helps to create movement and increase mobility. Activating the occipital lobes, creating space and movement so that cervical spine has more space. It's going to be more blood flow going into the brain. You're definitely going to experience less brain fog as well. Trying to activate the scalp. This helps to release endorphins and to relax the musculature. going to use hair pulling technique to decrease tension. I'm going to have you take a deep breath in and breathe out. And again, breathe in, breathe out. Okay, I'm gonna have you get dressed and we're gonna go in the x-ray room. I want to take a look and see exactly how the vertebrae look, and we'll go from there, okay? Okay, hold on. I'm gonna go ahead and put gloves on. And after that, take a look at your back. Let's go ahead and put your hair up. I read in your file that you're having some increased pain on the left side in the middle between the shoulder blades. Just going to examine your spine first and see if there's any signs of immobility. So I'm going to try to move your vertebrae a little bit and see how much space is between them. Feeling for any pulsations and see if there's any abnormal curvature. Okay. Taking a look at C1, your atlas, C2, axis, and moving down. Checking your scapula for any signs of luxations. Okay. I'm not feeling anything abnormal. There's no signs of inflammation. Just feels very tense on the left side. And definitely less normal than the right side. I'm going to take some measurements to compare. Make sure that there's no inflammation. I'm gonna go ahead and start working on increasing mobility on the left side. Also, this will help to restore blood flow and decrease muscle tension. It's gonna feel like skin pulling, So I'll be pulling the skin up and slowly releasing it. I still feel a knot there. So we're gonna try to work on the area until the muscle smoothens out a little bit. Going to work on the muscles next to the spine. They're gonna help to relieve some of the inflammation. Okay, I think we're gonna go ahead and do some adjustments. Okay, go ahead and take a deep breath in. Breathe out. Okay. And again, take a deep breath in. And breathe out. And again, take a deep breath in. And breathe out. Okay. And again, breathe in. And breathe out. One more time, take a deep breath in and breathe out. Okay. Go ahead and apply some oil to massage the sore muscles and increase the blood flow to these areas. Focusing on the shoulders first. This is gonna feel cold. You okay? It feels a little bit cold. Okay, moving down the spine, so you're going to feel that coolness and it's going to relieve some of that tension and pain. Just doing some deep tissue here, making sure that we're activating the lymphatic drainage as well. going to perform cupping therapy. This will increase blood flow in between your shoulder blades. Going to have a little bit of redness on this area, but it should go away within 24 hours. Does it hurt? Okay, this will apply multiple pressure on the pressure points here in between the shoulder blades. It's gonna feel a little bit cold until it warms up. Smile and frown. Hi, Emma.
Hi.
I'm Dr. Matt. I'm going to do your exam today.
Nice to meet you.
Nice to meet you too. Go ahead and verify your last name and your date of birth for me, please.
Yeah, Archbold, Archbold, and my date of birth is 12/01/02.
Do you have any allergies?
Not that I'm aware of.
Okay. Are you experiencing any pain at the moment?
I have a little bit of neck and shoulder pain and some mild heartburn.
How long ago did the pain start?
Probably a month ago.
And is it intermittent? Does it come and go, or is it constant?
It's constant.
On a
It's hard to sleep at night.
Oh, okay. On a scale of 0 to 10, 0 being no pain, 10 the worst pain, how would you rate it right now?
Right now, a 6.
And is it sharp, dull, or achy? How would you describe it?
Like a sharp ache.
Does it radiate more on one side, or is it central, or on both sides equally?
Both sides equally.
Tell me a little bit more about the heartburn. When did it start as well?
Yeah, it started about a month ago. I started doing more yoga, so maybe there's a correlation there. I don't really recall any dietary
changes.
Is the heartburn more after you eat, when you wake up, before you go to sleep?
It definitely is worse in the morning. And does flare up after I eat.
Okay. Are you experiencing any frequent headaches?
Yes.
Okay. How often?
I'd say once a day.
Okay. Are you taking any medicine for that?
Just ibuprofen.
And for how long have you been experiencing these migraines?
I thought they were normal, so maybe like 2 or 3 months.
Okay. Have you noticed any changes in your vision? Any loss of sensation?
No.
Are you experiencing any pins or needles in your fingers or toes?
Yes, in my left hand. In my hand. Yeah.
Okay. And which fingers are you referring to?
It's mostly like my thumb and my ring finger, I think.
Okay. Any surgeries or accidents in the last 12 months? Are you taking any medications besides ibuprofen?
Sometimes I take that like an antacid for the heartburn.
Okay.
And also birth control.
Okay. And does that alleviate?
Yes.
Okay.
I like the fruity flavors.
Okay. And for how long have you been on the birth control?
A couple of years.
When was your last gynecology exam?
A year ago?
Okay. What about your pap smear?
A year ago. I think it was the same appointment.
Okay. And do you remember when you had your last period? Approximate.
I think about a month ago.
Okay. Have you noticed any difficulty breathing or changes in your heart rate, any palpitations or rhythmic beatings in your chest?
Sometimes with the heartburn, yeah.
Do you have any family history of heart disease?
I do.
Okay. Mom or dad's side?
My dad's side.
Okay. Any history of thyroid disorders?
No, not that I know of.
Nor in the family, correct?
Correct.
Okay. Are you experiencing any weakness in your arms or legs?
Yes, in my arms.
Both or just one?
Both.
Okay. Do you have difficulty grasping objects?
Sometimes when I get the pins and needles in my ring finger and my thumb on my left side, it does
Okay.
spasm a little.
And when did you first notice this? Do you remember?
I don't know, it's been a while.
Okay. All right. So I'm going to start the cranial nerve exam and do some sensory tests to rule out any nerve damage. And also we'll do a full head to toe on top of that, just so that we are able to rule out anything else.
Okay.
I'm going to put my gloves on. I'm going to take your temperature first. This will go on your forehead. Any flu-like symptoms?
No, just the soreness.
on your index finger. Go ahead and relax. Okay. Blood pressure is within normal limits, 118/65. Oxygenation is 72% on room air. Heart rate in the 60s. I didn't notice your hands being very cold. Is that normal for you?
Yes, I have terrible circulation.
Okay. And do you have the same, are your feet cold as well?
Yeah,
For how long have you been experiencing this?
my whole life.
Okay. So let's go ahead and continue the exam. I'm going to do a vision check. Do you wear contacts?
I do.
Okay. When was your last vision check?
A year ago.
And your last prescription?
A year ago.
Okay. Let's go ahead and look straight here at my nose. I'm going to flash a light in your eyes. Very good. Go ahead and follow my fingers with your eyes only. Don't move your head. Are you experiencing any pain?
No.
Okay. Go ahead and look right here at the light. I'm going to bring this pen light very close to your nose. Go ahead and keep on looking at the pen light. Good. I'll just do that one more time. Okay. Any pain or pressure?
No.
Okay. Go ahead and look right here. Go ahead and look right here. A little bit higher. Let's go ahead and do that one more time here. Okay. Go ahead and give me one big ah. Any pain with swallowing? Okay. Tongue is symmetric and pink in color. Go ahead and give me a big smile and frown above your cheeks. Keep them puffed for me. Don't let me unpuff them. Good. Go ahead and relax. I'm going to try to turn your head towards your right. Don't let me do that. One more time. A little bit weak on that side. Go ahead and the same thing. stronger there. Just going to push down on your shoulders. I'm going to have you shrug your shoulders now. Okay. Go ahead and squeeze my fingers as hard as you can. Go ahead and just grab my fingers and I'm like in a fist. Okay, that's good. Go ahead and put your arms in front of you. Have you noticed any shakiness or trembling?
A little in the...
Okay. I am noticing a little bit of redness towards the tip of the fingers. Let's go ahead and check a capillary refill. It is a little bit delayed. We want to see it within 2 seconds. Okay, go ahead and try to keep your arms straight. I'm going to push it down. Don't let me do that. Same thing. I'm going to do this both in the same time now. Okay, I'm going to try to open your arms. Don't let me do that. First, I'm going to do left. Good. Right. Both in the same time. Okay. Now I'm going to try to push it up. Go ahead and tell me if you feel any pain. Resist. Resist. Good. Resist. Resist. Okay. Go ahead and relax. Okay. I'm going to listen to your lungs and heart. I'm going to have you take a deep breath in through your nose and out through your mouth. Take another deep breath in through your nose and slowly exhale. One more time. And breathe out. Okay. Now I'm going to listen to your heart. Go ahead and breathe normal. I can hear S1 and S2. And S3 as well. Usually we don't want to hear S3 or S4, but I think there is an S3 on your rhythm. And sometimes people can just be born with this and have nothing to worry about. So we're just going to do a few more tests. Okay. I'm going to have you turn the other way so that I can take a look at your neck and shoulders, and I'll listen to your lungs in the back as well. Okay. I'm going to take a look at your spine. Slowly palpating cervical spine. Just noticing a little bit of redness right at the base. It does seem to be superficial. I'm not noticing any edema. Palpating the lymphatic system. I'm not noticing any changes in temperature or volume. I'm looking for any abnormalities in the curvatures of the spine. Normal scoliosis or lordosis is expected. I'm not feeling any things swollen around the paraspinal muscles. We're going to take a few measurements. We're looking for any asymmetry, something that would indicate a degree of inflammation. About the fingertips, T1 to L1. That's 67. Just going to repeat that measurement to make sure that we have it correct. But it seems like there is just a 1 to 2 degrees difference. It's very insignificant. This is going to feel a little bit cold. Just going to measure for any swelling. Slight swelling on the the right side. Let's start with T1. Right scapula is indeed a little bit lower than the left. Going to listen to your lungs. Go ahead and take a deep breath in through your nose. And breathe out. And again, breathe in. And breathe out. Again, breathe in, breathe out. Again, breathe in, breathe out. I can go ahead and just breathe normal now. I'm going to do a few more tests. Go ahead and tell me if you feel this on the left or right of your back.
The right. Left. Right. Left. Right. Left. Right. Left. Center. Center. Right. Left. Left. Right. Right. Left. Left. Right. Right. Left.
Okay, I'm going to look for any deviations in heat disturbances around the spine level. And I will mark those points so that we know exactly where we need to focus on. There are only 3 points that seem to need adjustment. I'm going to touch you with two textures. One is going to feel dull. This is what dull is going to be like. And the other one is going to be sharp. This is what the sharp is going to be like. Go ahead and tell me if you feel this sharp or dull.
Dull.
Sharp. Sharp.
Dull. Dull.
Sharp.
Dull.
Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Go ahead and tell me if you feel this dull all the way down.
Yes.
And does this feel sharp all the way down? Any numbness?
No numbness.
Okay. What about now? Does this feel dull all the way up?
Yes.
And does this feel sharp all the way up?
Yes.
Okay, I'm going to do a micro adjustment here. It's going to relieve any pain and tension. It's going to help with spinal movement. Okay. I'm gonna have you change into this gown and I'll have you relax on the table and we'll do a full body head to toe examination.
Okay.
I'm going to touch your temples. I'm looking for any tension. And sinuses right in between the eyebrows. And right under your eyes. I'm not noticing any puffiness or swelling. I'm going to palpate your lymphatic system, looking for any lymphadenopathy. Palpating preauricular lymph nodes. And postauricular lymph nodes. Moving down to skull plexus. Palpating supplemental lymph nodes under the jaw. Going to test your reflexes. Go ahead and relax your jaw. Good. Go ahead and tell me if you feel this vibration. Do you feel this?
I feel it.
Okay, go ahead and tell me when it stops.
It stopped. 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 It stopped.
Okay. Which position here is louder? Position 1 or 2?
2.
1 or 2?
1.
Going to take a sample. We're looking for any mycobacteria that could trigger neurological symptoms. And we're going to send this to the lab. Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 2. 2. 2. 1. 1. 1. 1. 1. 2.
Do you feel this cold or warm?
Cold.
Do you feel this cold all the way up?
Yes.
Okay. What about now? Does this feel cold or warm?
Cold.
Does it feel cold all the way up?
Yes.
Okay. Go ahead and tell me if you feel this cold or warm.
Warm.
And now?
Cold.
Okay. Do you feel this warm all the way?
Yes.
And now?
Yes.
Do you feel this equally on both sides?
Yes.
Do you feel this equally on both sides?
Yes.
And this?
Yes.
Okay, I'm gonna have you open your mouth and close. What does it taste like?
Nothing.
Okay. That was the control test. Go ahead and open again. And close. And open. What does that taste like?
Nothing.
Let's go ahead and check your smell. Go ahead and take a deep breath in through your nose and out through your mouth. Let me know if you need to do that one more time.
One more time.
Okay. Are you able to identify the smell?
It's sweet like lavender.
Great. Let's go ahead and do that on the other side. Go ahead and take a deep breath in through your nose. Would you like to smell one more time?
Please.
Breathe in through your nose. What does that smell like?
Maybe eucalyptus or pine.
Okay. I'm gonna turn your head to the left. Just take a look behind your ear. Skin looks intact. I'm not noticing any redness. Epidermis is well perfused. Going to check your scalp. scalp. We're looking at hair distribution, any signs of alopecia, eczema, psoriasis. I'm going to do a few tests here. I'm going to touch you with two objects. One is going to feel sharp and the other one is going to be dull. This is what sharp is going to feel like, and this is what dull is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. 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 Sharp. Sharp.
Do you feel this sharp all the way?
Yes.
Does this feel dull all the way?
Yes.
I'm going to attach a neutralizer to the hair follicle so that we can collect a sample. Now go ahead and tell me if you feel this 2, 1, or 3 pressures.
1.
1. Okay.
1. 2. 1. 2. 2. 1.
I'm going to do a lymphatic massage around the ear and behind it. This is going to help stimulate blood flow to the scalp. It also helps to remove any toxins that have been accumulating in the lymphatic system. I'm going to turn your head just facing up. I'm going to check your trigeminal nerve. I'm going to just apply gentle pressure right here on your TMJ. Go ahead and slightly open your mouth. Any pain when you do that?
No.
Okay. Now I'm going to have you open it slowly as much as you can. Good, and slowly close. Okay. I'm not feeling any popping, which is great. Let's go ahead and do that just one more time. Okay, go ahead and close. Alright, I'm just gonna look now for any microscopic sounds that are really hard to distinguish. So this is gonna go just right here in front of the ear. Go ahead and slightly open your mouth one more time, as much as you can, and gently close. Okay, just a little bit on the right side. I would say you're at the maybe 2nd degree there. Go ahead and slightly open again. And close. Okay. Palpating scalp for any lumps to see if there are any asymmetries. The scalp is very mobile, which is absolutely great. Do you drink coffee?
Yes.
Okay. No signs of mastoiditis. Alright, I'm going to go ahead and move down to the abdominal assessment. Okay, Emma, I'm just going to first listen to your abdomen, see if there are any abnormal sounds before we even touch it. So just go ahead and relax. Is it okay if I lift the sports bra a little bit higher? Okay. Just gonna have you put your arm here, relax. Okay, this is gonna feel a little bit cold. We're starting with the right upper quadrant. Okay, moving to the right side. Okay, so the superior abdominal area sounds good. Now I'm moving to the lower part. left lower quadrant is within normal limits. Moving to the right lower quadrant. A little bit diminished on the right side. I'm going to do a few tests. This is a solution that helps to neutralize a sensation. I'm going to draw a letter. Go ahead and tell me what letter you feel.
R. M. B. Good. G.
1 out of 4. Okay, I'm going to wipe the solution off. I'm going to go ahead and just slowly percuss. Please let me know if you feel any type of tenderness. Sometimes this movement can elicit some pain or tenderness, and we want to make sure that we are aware of it. Very normal sounds there. I'm going to listen to your abdominal aorta. We're looking for any buoy. going to slowly palpate. Let me know if you feel any kind of pain. This palpation is just very superficial. Okay, let's go ahead and have you turn over and I will do another back exam. Okay, I'm going to first palpate to make sure that there is no swelling around the cervical vertebrae. No signs of scoliosis or lordosis. Very normal curvatures within normal limits. I'm going to listen to your spine. You want to make sure that there are no microscopic sounds. Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 1. 1. 1. 1. 1. 2. 1. 2.
Okay, go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Go ahead and tell me when you don't feel the vibration anymore.
I don't feel it.
And please let me know if you feel this cold or warm.
Cold. 1.
Do you feel this warm all the way? Do you feel this cold all the way? What about now? Sorry, what about now? Does this feel cold? Okay. Does this feel the same as this? Does this feel the same as this? Alright, I'm gonna have you sit back up and I'm going to discuss the results. Okay, Emma, I do recommend that we get an MRI of the chest and neck just so that we rule out anything serious, but the health physical exam turned out to be really good. I didn't see any abnormalities. Everything was within normal limits. Even that you had a little bit of sensitivity or numbness in certain areas that could also be triggered by seasonal allergies or something like that. So we're gonna run a blood panel. And the CT. Do you have any questions for me? No. Okay, great. I'm gonna have my assistant reach out to you with the results and we'll let you know how everything is going. Thank you.
Thank you.